record.
That would never be a problem for me.
All right, we have xylazine strips. We have a van in place. The boxes are going to be delivered here shortly. We're working on finishing out our community engagement piece with that so they can be installed. Anya gave a great talk at the Rose Theater. Did I hit the high points? Yeah. Okay. Dr. Carlbaum, anything on your side?
No, not a ton. Unless there's something people should remind me of. Had a good meeting with a bunch of commissioners, fire department commissioners in Brennan, met some state representatives, and yeah, I think we'll see. I think there's lots of transformation happening among EMS, particularly in South Jefferson County. So, but yeah.
I wanted to ask, do you have any idea if at the coroner's office we're testing for xylazine on potential fatal overdose? We don't know, or we don't do that.
Sorry, I don't know.
Okay.
Apologies.
Okay.
Yeah, I don't know. I guess when you shared the data from the past, I fear the coroner is not capturing a lot of cases that I think could potentially be drug associated. Right? A 50-year-old found with drug paraphernalia in an RV dead is sometimes listed as natural causes, and that's true as the mode of death, probably, but to me that feels like a drug associated death unless proven otherwise by lack of any toxicologic substances on screening. And I don't know.
Would a request to test for that need to come from like the prosecutor's office, or who?
That is the coroner.
Yeah.
Yeah, that's the challenge. It's the same.
Like, so I would think that would be very important information to track what's in our county. So
yeah, I think my impression has been it's the lack of a medical examiner, and so I think there's just too much work, and so I think there's not a lot of curiosity about, oh, what are the trends that are coming. They're just like, we got to just keep moving. So
it is changing though, right? There's legislation last year. We're going to have a de facto coroner, I think, in the next year or so, right?
Are we? I did not know that.
You tell.
I can find out. That's about all I know, but I think James Kennedy reported that they were, he didn't have to be in the coroner business for too much longer with the new legislation. So I'll get an update and send it to Lori to distribute.
Oh, great. Thank you. That would be exciting because that is a lot to ask of that office, as much as they've got going on over there.
Hatchet attacks and all.
Right. Lori, Tinker, anything going on in your corner you want to let us know about?
No, not too much. Hospitals in a lot of construction turmoil right now. But I showed up for a meeting and realized I didn't know where to go. Because everybody's been moved everywhere. But no, I think everything's doing status quo.
All right. Thank you for being here. Commissioner.
And I have to leave at 1:30 as often for a transit meeting to look through, among other things, 4 great candidates to add to the Jefferson Transit Authority, including school board members from Quilcene and Chimicum and Port Townsend and Jefferson Healthcare. So all great members, but I definitely hope our Quilcene school board member who's on the advisory group makes it. And I was at the meeting with Dr. Carlbaum last week with the fire commissioners, and I think he's being a little modest. I think that he is largely responsible, was my impression, for the culture change down in South County. I think there's a lot of respect there, and the harm reduction philosophy that he definitely models is I give him a lot of credit for the transformation in a group of fire groups that has traditionally been pretty conservative. So I was impressed.
That's so lucky.
And finally, just kind of in the brainstorm range, I read this interesting article by Sam Quinones, I'm not sure how to pronounce his, in the Atlantic, that several people sent to me, including housing advocates and homelessness advocates. And I talked to Dr. Barry about it because I had the opportunity to bring Sam out for a panel. And Dr. Dr. Barry was not a fan of the article, thinking that it had a lot of not a lot of evidence-based information in it and a lot of fear mongering.
Mhm.
And so I am kind of convening a private conversation with law enforcement and Dr. Barry to talk about harm reduction and progressive jail policies, many of which we already pursue. Therapeutic courts, diversion, and as well as MAT in the jails and everything. But want to really get Dr. Barry engaged in a harm reduction conversation with our law enforcement side, and just would open it to anyone here that wants to participate in the conversation. I will include you as well. And that's my update.
That'd be great.
Commissioner?
Be wonderful if Dr. Carlbaum could be there.
Yeah, could you note the article again, the author?
Yeah, it's called America's Approach to Addiction Has Gone Off the Rails. It was published on June 1st in the Atlantic by Sam Quinones. I don't know how to pronounce his name, Quinones. He's also written some really good, or I thought they were good, narrative nonfiction, where he kind of embedded with folks dealing with addiction, and he's really concerned about the new fentanyl and the new meth as well. I've heard some great podcasts with him as well. I think he's his heart is in the right place, and I'm looking for a way that we can leverage his prominence to have a good conversation locally. But I'm still working around that.
Are
I
you
think
able
he-
to share that as a PDF? So I sadly am frugal and don't have a subscription to the Atlantic and have used up my 2 free articles for the month.
It is behind a paywall, but I have a copy of it that I will just illicitly copy and distribute also to Lori to share with folks.
I promise to
Thank you.
shred as soon as I'm done reading it.
I do know that, for instance, in Snohomish County, quinones has been used very much on the sort of maybe more conservative approach as an advocate for that more conservative approach. So interesting to figure out how we could use his, as you say, his notoriety in a way that actually serves just generating the conversation more. Yeah. In the way.
That's,
So-
if I could add, that's an important conversation to have, no matter what his perspective, as long as he's a reasonable person and discourses politely.
Mhm. Right, yeah. Thank you, Greg, for sort of exploring that. Holly, anything going on in your corner?
Yeah, we, like many grant-funded pieces are wrapping up the fiscal year at the end of the month. So we had some great planning meetings through May and June for the Prevention Coalition there for Quilcene and Brennan, and the group voted to fund another day of counseling at Quilcene. We just need to let Quilcene know now.
Right, there you go.
They're in a state of flux right now as far as leadership goes. Existing folks leaving, new ones hopefully coming on board soon. And then working with Jeremy down at the community center to do some summer programming for young people. Actually had a meeting with Amanda Christofferson from our environmental health team. She actually extended the offer to lead some kind of conservation-based youth programming in collaboration with the Prevention Coalition, which I'm super excited about. So as those develop, I can share that goes. So funding or pending funding approval, we should have at least a couple solid dates for some South County youth engagement programs.
Great, thank you, Holly. Sheriff Knoll. We're just looking for updates. We know who you are.
Yeah, sorry, I was late. And I guess I don't really have a lot. One thing, as we all know, and I can't remember if I saw people at other meetings, but one of the things for us was that the legislative session is over, and so now we can start working on how we're going to do things. And I guess something for South County, we're doing active shooter training down at the Quilcene School, and tomorrow that actually starts. So I think we have 3 days of it where, you know, you could just go one time, but, and there'll be participants from other departments and whatnot. And, I don't want to steal Tim's thunder, but they're going to be involved too, as far as I know. So, anyway, that's all I have, unless anyone has any questions.
Thank you. Chief McKern.
Well, I'm sorry I'm late. First off, I had to find the right link. That was number one. And number two
Oh,
is
I'm sorry.
I'm not in my south end. I'm actually up in Port Angeles at the fire up here. So I'm sorry, Sheriff Noel, I'm going to miss your training. I'm going to be here at least through the weekend, but I can happy report that the fire's under control and we're just finishing up our mop up. But they had a Saturday fire start, about 85 acres, and definitely kept things on the did some evacuations of some homes, but we got it under control. And I think we're on the downside of it and get them back and check where they're at. So only reports is I think Holly, you reported on some of the new things for the schools. We had a great end of the year, and I think we're going to continue moving forward with a lot of that stuff. Haven't seen our Narcan kits yet, but I know they're coming and they shouldn't be too long and they'll be in here pretty quick. So
Yes, they are on their way. We get them here. We might have a little bit more that we need to sort of finish up in talking with folks who will be installing them. And then we'll at least get up the ones that we've agreed to down in South County.
outstanding. I think that's all I got. Helicopter training we're going to have on the south end this Saturday. Thanks, Dr. Carbon. I apologize, fire calls, and unfortunately I can't promise you my crew will be there, and Nick and all the rest of those folks, they just may not have the fire chief there, but the rest of it, carry on.
Thank you.
Looks like you might want to get ready to evacuate. It looks all smoky where you're at.
No, yeah, it's not. The back of it's all kind of faded. I do that on purpose. So I'm in the classroom at the Dry Creek School in Port Angeles, where our ICP is.
And sorry, but where did I remember someone tell me the fire started behind something. Where's it at?
Well, if you're familiar with Granny's up in Joyce.
Yeah, that's right. It was Granny's. It was up behind Granny's.
Right behind Granny's, and they've got about 108 acres.
Yeah.
And so we actually got it before it got to the top of the hill. So we're cleaning that up and putting it to bed.
Yeah. There's a few trees out there.
Yeah, there's Granny's is, I see a question from Dr. Carr. Yes, Dr. Carbone, we saved Granny's just for you. So yes, Granny's is fine. Surprisingly enough, we've done a number of, I happen to be doing the PIO and liaison stuff. And so believe me, that question, sir, has been the question that has been answered a lot. And even the news media was here today and we answered that for them. Granny's is doing just fine. Some of the photos they had are coming from Granny's. So.
Well, thank you for all your work out there, and I'm really happy you could make it here today. Lindsay, any updates from your corner?
No updates from me. I think Holly and Denise covered it. And of course, most of my work is based in Port Townsend. So I'm here to learn and of course, Stan, everything you do. Thank you all. Good to see you.
Thank you, Lindsay. Gabby, how about you? Anything updating in your corner?
I do have some updates that I'll be sharing next time. We do have some exciting new programs rolling out, but I'll have more about those next month.
Okay, great. Well, I'm going to jump quickly, and some of you know, I got a Shingrix shot yesterday, and so I am both shivering and sweating and so achy that it hurts to move my eyeballs. So we're going to move maybe quickly, but if not, we've got the rest of the hour. Quickly, I wanted to go through the both the update on the Naloxone boxes you've already heard about, and then to talk a little bit about the sustainability work group, the recommendations that they came up with, give you a little bit of an overview of the discussion that was had on the various recommendations that we put forward at the BHC, just so that some of you who were not at that meeting were not able to participate in that discussion. I want you to know where it is sitting at. I'm going to share my screen really quickly. Can folks see that okay? Yeah. Good. All right. So basically, the presentation was just quickly to show them who was here for the discussion last week or last month when we had it. We used the South County Harm Reduction's time slot there to have that conversation. We talked about where the BHC would be anchored and recommended that they engage DBH to serve as the anchor and as the pass-through, and that was approved as a whole from the group. There was a good bit of discussion around who is on the BHC and what is their commitment. And part of it is the data collection, which I think people were on board with. Switch over here to the concept. We gave them a concept of having a two-tiered system where we had some partners who signed the MOU and who would have voting capacity, and then a second level, which would be cooperators, which would be the range of people that you want in on those discussions and participating in the strategic development of a plan that we would then execute. The conversation around the idea of the stratification of the two levels was accepted in concept. There was some good discussion that happened around the who should be on what level. Chief Black noted that the BHC should address more than substance use and mental health from his perspective, and he also wants the BHC's purpose and responsibilities expanded. For example, the idea that people who are on the BHC, I think he feels they don't get anything back, and he would like to see grant writing support from the BHC. And then he thought rather than having the Fire Chiefs Association hold the vote for all of the fire departments, that it was important to have each fire department give their, represent their own perspectives because they're different entities with different needs. So he suggested putting all of the fire departments on in the partner role so they would all have votes. He also suggested that the OCH be on the BHC as a voting member. So those are all topics for discussion. Nothing was decided one way or the other, but as we go forward, that's something to think about.
What's OCH? Sorry.
It's the Olympic Communities of Health, who recently
That's what I thought.
gave out a bunch of funding, which was interesting because they don't attend the OCH. They don't attend the BHC, but they put out a bunch of funding here. So it would be great for them to be a little more involved, maybe, and aware of what's going on in Jefferson County at the BHC table, or at least at those stakeholders' perspectives. Moving forward, there was a discussion about what does short-term or what could short-term funding look like. There was some discussion about a $35,000 resource that might be available to secure someone like me or someone else to oversee the continuation, at least, of the BHC's data collection and to facilitate quarterly meetings. When we had discussion on that, I'm looking here. I went through and actually listened to the recording, so I made sure I was quoting people properly. There's some discussion yet to be had. It seems like it's a fairly easy conversation, but there's some discussion yet to be had about the 35,000 and whether and how it goes. And input needs to be gathered from Jefferson County Public Health and from the BHC. Evidently, the funding is already sitting at the SBHASO, so it's just a matter of having those conversations and figuring out, if that is something that everybody agrees to, and if it is, how do we make that happen? And Greg, have I represented you properly there in your?
Yeah, I think, and I am setting up, just to go one step further, setting up a workshop, an afternoon workshop, and working with Apple to figure out who should be at that workshop right now. So in the next couple of weeks, we'll try to take it to the next level. But that's absolutely clear. One, I'd love to see maybe Jefferson County as one of those partners and cooperators. And
good thought. Let me add that here.
And I didn't really want to weigh in. It was a robust conversation at the meeting, but I really liked kind of the roundtable atmosphere that's the BHC that doesn't make different classes of groups. So I'm not totally fond of that.
So you think it's worth the conversation of, do we stratify or do we not? Do I understand that correctly?
Yeah, I understand some of the advantages. I'm just I like having everyone at the table. I think that's one of the strengths of it. But
agreed. Agreed.
And
So,
I'm gonna have to take off in just a minute, so when I disappear.
okay.
I apologize.
And have you been able to say everything you would like to say, at least about this question of sustainability before I let you go?
Yep.
Okay, all right. Coming back then. So that was short term. And then this idea of what we would do in the next iteration of whatever the BHC is to basically do a plan, an assessment and planning process, update the vision. So some of these conversation or discussion points that we heard brought up, what is it? What does the BHC do? Does it help people get grants? All of that could be sort of discussed as a whole table rather than just as, you know, sort of a quick stopgap of what we're trying to get done. So the idea that we would apply for some sort of a planning grant doesn't have to be a planning grant, doesn't have to be 200,000, but something that would allow us to do the work that we outlined here on the previous slide is what folks would like to do. And then there was an approval for us to apply for a no-cost extension for the current grant that we have, which would allow us to do a few things. It would allow us to clean up the data that we discovered had a great opportunity for restoring some integrity to it from the law enforcement end of things. And then to have HFPD get in there and do their analysis they usually do once we've fixed that data. And then we also want to extend the time point during which HRSA would not begin to ask us to relinquish the vehicle that we just got bought for OWL 360 to do their youth transportation. That would give us another year before we even have to deal with, maybe they will, maybe they won't ask us to relinquish it. It would give us the time to sort through the expanded community engagement required on those naloxone boxes. But I do want to underscore that Denise noted that whether or not we get the NCE, Jefferson County Public Health will make sure that the boxes that we bought, you know, get installed in appropriate places. And so we're really grateful to Public Health for that.
Lori, am I remembering that the ask for the 1-year extension, it's not a slam dunk, but it is a probable we would get it?
It is not a slam dunk, but I think we have good reasons to ask for it. And it isn't that we haven't spent hordes of our money. It's that we haven't been able to get done everything that we wanted to do with the money that we had. And we can make a pretty good case that there was COVID, there was leadership transitions, both in terms of in the agencies that are at the table, as well as, you know, the project director for the actual grant. And I think that they're going to view it favorably, but we'll see, you know, if I'm mistaken. It would also perhaps this last thing that you see here have a little bit of funding to help us if it takes a long time for that $35,000 to be figured out one way or the other from the county. It might allow us then to have at least one quarterly meeting at the end of this year and to continue our data gathering efforts. So I think that is the highlight of what folks thought about the proposal and the things that are coming out of it. I'm in the process now of applying for the no-cost extension. You heard what Greg said in terms of the efforts moving forward he's doing with Apple to see if we can figure out the possibility of future funding, small funding at least from the county. And so we are not having a behavioral health consortium meeting in July because I'll be back in DC for the grants reverse site visit. But then at possibly our last meeting, or maybe it's just, you know, the last until the final quarter of the year, we'll discuss a little more about, I think we're going to have some individual conversations before coming to that meeting that sort of come up with a recommendation of how we handle who is on whether it's cooperator and partners, or it's just one level of folks. I think that's probably the biggest question that we need to address and get people's buy-in. So I'll be coming back to several of you to have those conversations individually. And then Sheriff Knoll, I know you have been on vacation, so I haven't wanted to come back and harass you, but I would love to catch up with you right after this meeting to see if we could figure out how we might have the sheriff's office help us get the city's law enforcement data updated.
Yeah, sorry, I haven't been. I was at training and then vacation. Then on vacation, my wife broke her leg, and so then I was out another week. not knowing because she was anyway. So yeah, I feel like I've missed everything. And since I'm talking right now, I don't know how all the discussion went, but I guess I wanted to go on record as saying I was kind of disappointed with some of what I saw was discussed, and I'm not part of this to see what the sheriff's office can get out of it. And I've never thought of it that way. I thought that we all work on this for what we can do for other people. So I want that's not a priority of mine, is what I can get from the Behavioral Health Consortium. I thought we did it for other people. So I just wanted to say that.
Thank you. Chief McKern, I see your hand and I just want to insert here. I have heard from a few different quarters that there are a few BHC members who are saying that the BHC has dissolved. And I would like to clarify that at this stage, well, maybe I should ask you guys, are you under the perception that we are dissolved or that we are trying to dissolve? I would appreciate it at the tables that you're at, where you have other agencies who maybe aren't as clear on that. If you could help us be clear. We're not at that stage yet. We might get there, but we're not there just yet. And I think it does a disservice to the work that's still ongoing to suggest that there is nothing going on at the BHC and that it's going to shut down August 31st. Chief McKern.
It's okay. What you said makes sense. I want to second what Sheriff Knoll is saying. I think we need to step back and look at this from a 60,000 foot level, not from a 10,000 foot level. And I think that's what's happening is what the sheriff said, I second that. The fire chiefs have not officially met, but I have met with 3 of the 4 fire chiefs, and we all agree that at this point, it appears that we're all going to be signatures on there alone. And then I have a feeling that probably, I hate to put this back into you, Lori, but I think we probably need to take a look at the mission and vision of the plan and then somehow adjust. Once we see that plan, I think I know that what I'm not speaking for you, Sheriff Knoll, but I think we could probably help you steer. We're at a too low level. Our mission and vision is at 10,000. And I think people need to understand that this is not a funding source for them. This is a funding source for our community. And we have to somehow step back and say that. I see a nod from my doc because I work for him as well as anybody else. And I'm sure Dr. Carlbaum and this is unsolicited, but he and I echo the same thing. So I think the 3 of us are on the same page.
I thought we all worked for Lori.
Oh, we do. Oh, okay. Yeah, we all work for you, Lori. So there you have it.
And you know I work hard for you guys. Well, it's
and the sheriff, all the sheriffs have no guns and stuff. Let us know who's starting this rumor, and the sheriff, I'm sure, can take care of that for us.
Well, I think it might be a misunderstanding that's just out that we have a great opportunity to clarify.
Yes, we do work for you, and I apologize. I work on the side. I work for you and Dr. Carlbaum. All yours, Doc.
Well, and we all work for Dr. Carlbaum. Dr. Carlbaum, what do you have to say?
Yeah, I would encourage the sheriff to compassionately arrest whoever is saying the BHC is dissolved, and for their own safety. Because I think once other members find out, they might be frustrated. I agree. I think the BHC is leveraged a grant that wanted data to improve our community, and like I can't think of a better forum, right? It really brought a ton of disparate people together, tried to unify the response to behavioral health. I would love to hear Chief Black's suggestions about what other topics it should cover other than behavioral health. That might take a change in the mission and vision, since it is called the Behavioral Health Consortium. And I guess I would love to. I wish he were here, so I could hear more perspective, because I do believe he has 46,000 reasons that the Behavioral Health Consortium helped his fire district, which is $46,000 that the group chose to give to them to support their efforts. So I think the group should continue. I like the suggestions. I'm happy to participate as I can with honing the mission and vision. And some of the other work for grants, etc., because I get a sense that you're probably super busy.
Any other thoughts? Public health, Gabby, Holly, Lindsay? Or let everybody go.
This is a bit of an aside. When I was tabling down at Fjord Fest prior to Memorial Day, One of the attendees there with Kitsap Mental Health wanted to remind everyone that they do have a pediatric inpatient unit that's 10 beds. I'm sure, I don't know if that's common knowledge. It was news to me, so I figured I would share that piece. I had inquired about transportation services, which is definitely a barrier in some of the more, rural areas such as this. And that's a conversation, I guess, that is in the works. But they are hoping to continue to promote that service to that Tri-County area, Kitsap, Jefferson, Clallam, that there is a 10-bed unit for young people who require an inpatient interventions.
Where's that at?
Bremerton with Kitsap Mental
Bremerton.
Health.
Okay.
But Bremerton sometimes is easier than Seattle. So
Do you know if they're like full?
I do not know, but I did ask what access looked like, just, because you can't be like, how many people do you have in there right now? And the person said that it was very good, and they're actually trying to promote it more in order to utilize the services more, which tells me they are not at capacity.
I
That's
asked that.
wonderful.
I remember when we were looking at doing something like that, we found, at least what my recollection was, we found out that even if we didn't have any of the beds full, then we would have to accept people from elsewhere, out of county. And so in effect, it was like it would always be full. Anyway, that was.
Well, then I think that's good information. I have to honestly say, it would be a super stretch to say that I have ever successfully heard of a transfer from the hospital ED to that unit in Kitsap for pediatrics. We have always found them full or not accepting or understaffed, and therefore, deferring. And I that's not that is not as sharp a criticism as it sounds. It's a very small unit serving a very large distressed population. But I certainly will pass along that the most recent statement is that they are looking for patients. That's good to know.
Yeah. I have heard scuttle too at the OCH table. Scuttle is the wrong word, because I think it was Bruce Brent Simcock who said this, that they have gotten the funding to go ahead with a 16-bed treatment facility, which I'm sure is a ways off, but just that we're even in the place where the funding has been approved, I think is wonderful steps in the direction.
Yeah, and I wasn't saying that to be critical. It's just that it just amazed me when I learned that and thought, what? Then it's like, we need hundreds of beds, whatever you want to say.
Yeah.
Right.
It's big.
Okay, so our next meeting will be hopefully with a link that works, that I won't have to send you 6 emails before you get one that actually does work. It's on July, sorry, it's the wrong date in here. I think it's July, it's old.
No, it should be August, shouldn't it?
For this meeting, it will be July 18th,
Oh, okay.
Tuesday, July 18th. And I may just try to send you out a link now and hope that it holds and it's good. Yeah. Anything else before we go? I wanted to check in with Sheriff Knoll, and then Denise, if you have 2 seconds before we go. Yeah. Okay. Oh, wait, Dr. Carl.
Quick question. The naloxone boxes, I'm a little confused. So it sounds like there's someone who's having some worry about potentially being blamed for mounting these boxes when a large community of representatives have all said, please do this. Are there next steps? Because I got the sense that from your overview that the engineers who are going to actually install the boxes don't want to do it.
Thank you for bringing that up. Denise, I wanted to give you a chance to address that.
So the community center in Quilcene is where we're having a bit of a holdup, and I would say that probably that would extend to all of the other community centers, because the buildings are owned by Jefferson County. And so we're going through central services to have facilities mount the boxes. And it's generally the consensus among the facilities folks that when something goes into a building that they are servicing, they get the pushback from the folks who use the building. So that would be the population of people who are coming there for events. And their concern was that the community centers are largely for elderly population, and that they would potentially have some issue with naloxone boxes. And to that end, they wanted us to have some community meetings to get feedback. Letters was a word that was used from community members that said that they approved of this. And so we are going to have a meeting when Anya gets back with facilities and Greg Brotherton and Central Services Director to discuss and help educate them on the fact that naloxone is just a life-saving device, just like an AED is a life-saving device. And so it isn't to be conjectured with drug use. It's just a life-saving device. So it is something that is valuable for them to have on their buildings. And so once we do the education, we're believing at this point in time that we will not have any more further problems. But should we have further problems, we can just take other steps to educate the community, like hold a meeting in the community centers, invite all of the people who actually use the community centers rather than just agency top level agency officials, which is essentially what we where we passed this through, not the people who are actually coming to events at the centers. But yeah, we'll just take next steps. I don't think it's too big of a roadblock. I think everything will be fine.
And Denise, are they aware there was a community meeting in the community center with the community, and that in general, I believe there were a few people that had some concerns, but overall it was pretty overwhelmingly positive, including the 2 church members who run youth group in that building, that it should be installed.
Yeah, no, we talked about that. Yeah.
Mm.
Yeah, I think it's just, I think it's just fear, and we'll be able to educate them and everything will be fine. Yeah. So
Can we go ahead and move forward with the installation at the fire stations though? Since those are not
everywhere that we don't have any pushback, absolutely. Yes.
okay.
And so though, for instance, the county library, their facilities will install. I'm guessing at the fire stations, your facilities folks will install, that kind of thing. So we're just having a little bit of a kerfuffle with the folks who are going to install them. Yes, on the county-owned building.
Thank you, Denise.
Just
Jeff?
sorry, but I was talking the other day, I think it was on the CJTA meeting with the funds for drug court and stuff, and anyway, and the topic came up, but I thought I would like to have a naloxone box at the sheriff's office, and which I never got involved on me in the beginning, so I don't know if there's any boxes extra, or
Sure.
if I was to order one, could I get naloxone to put in it? So should I call you about that, Denise?
Sure, because we definitely have a naloxone box for you, Joe.
Okay. And then I didn't know if that might help with Quilcene. I mean, everybody's putting one in except you guys. So But yeah, that's something I wanted to do. And I thought, well, who's going to come here and get it? And it was actually Richard Davies says, well, you got people coming there all the time. And I thought, I never thought of that. So,
No, thank you, Sheriff. Denise is right. I think we got a box and we can find you naloxone and get you all set up. Great. Any other thoughts before I let you folks go?
Hey, Denise, if you need a letter like from the garden club, we are moving forward with a new AED for them. We've been training them in citizen CPR to the tune of like 2 or 3 classes a month. They certainly, not that they're in our back pocket, but they're certainly there and moving. And I think the shakers and the movers, I think it's the right place to have it. That's where I think the food bank could also, the food bank is another each link that's there several times a week. So, yep. If you need letters from those folks, let's talk some more next week.
Yeah, if you can get a couple of letters, it can't hurt us for sure. Yeah.
Okay.
So
Thank
that
you,
would be
Chief.
fabulous. Thank you, team.
Yep.
And then
just a reminder, all the deputies we all have naloxone in our cars.
Oh, good.
And that's the same in the city. Am I correct?
Yeah, the city,
Yeah.
as far as I know, the city does too.
Yeah. All
and
right.
then Denise, is there a process to think about? Like it seems odd to me when the leadership of the county says, could you please do this? And one human is like, no, I won't do that. Like,
Well, I think it's
I'm not allowed to
really
do that at my work. Is there a process for sort of working out how that works in the future?
well, the Central Services Director is second in command of the entire county. And so the Central Services Director, in terms of a chain of command type of operation, is above all of us.
Okay.
So that person could say that in a chain of command sort of
Who's at the
situation.
top, just out of curiosity?
The sheriff is.
The sheriff likes to think he is, but he is
I'm right under the Quilcene Fire Chief.
he is just an elected official.
Yeah.
But anyway,
Well,
Mark
yeah.
McCall, the county administrator, is the top dog of the county. Central Services Director, second in command, and then come the heads of departments. Yeah. So
And
But
they
yeah, the
work, and they work for the commissioners?
Yes, their commissioners are above all of them.
Yeah.
And I would think that if the commissioner said put these up, it's like you go put them up. So I don't know if that happened or
well,
not.
I think, but in terms of this kind of conversation and this kind of decision making, I'm sort of not on. I'm not in agreement with this kind of decision making. I'm more of a consensus decision maker, and so I would like to have Chris Goy feel good about what he's doing in terms of putting up these boxes. So I think it's a fabulous idea if Tim can get a couple of letters and gives them to us and we do our education for them. Because, the point is to help everyone understand and to destigmatize and to get rid of patriarchal, masculine ways of doing business. So yeah, I'm kind of a consensus model.
And I agree. I think that's the best model. As a disaster planner, I just worry what happens when he says, well, thank you very much, but no. So, but we'll cross that bridge when we get there.
Other thoughts before we let everybody go?
Be nice until it's time to not be nice.
Thank you, Denise. I appreciate you articulating the position of public health and I think that it is a great idea to have everybody on board and sort of.
Well, I don't know if I'd want this going down in history on your recording as the position of public health, but in terms of decision-making models, I'm more of a consensus model maker. I don't know what public health is. Yeah, so
okay, I'm sorry. I wasn't trying to put words in your mouth. All right. Well, after that interesting little conversation, I want to make sure that you all go away. Have a productive afternoon. I'm going to try to talk to Sheriff Knoll. And Denise, I think we covered what we were going to cover. Okay.
And just to let you know, I have a meeting right after this, so I don't know if you can call me.
3 minutes of your time, and then I'll let you.
Hey, yeah, I can do that.
Okay.
We're all off now. Goodbye.
Goodbye. Thank you, you guys.